This is Dinoy Eliza Mariti, and I'm going to discuss my early worksheet number 1 in NCM 112, which is entitled Significance of Laboratory Result. So I am assigned in case number 6 of a 2-year-old toddler who experienced greenish liquid stool.
Good day. So for today, I'm going to discuss on how to instruct the mother in collecting and handling the stool sample. Also, I'm going to discuss the health teaching based on the client's case and also the laboratory test result.
Collecting and handling stool sample of a toddler. It is fairly common for your child to have green poop at some point. It's usually harmless. It often just means that the stool passed through the intestines more quickly so that all of the normal bile, which is the green color, did not have time to be absorbed back into the body. Green color is usually normal for a toddler. Most often, green stools are caused by bile, which is more common in formula-fed than breastfed infants, but they can be normal with both. So let's discuss what causes green diarrhea. We have green or purple foods such as leafy vegetables. We also have iron-rich food or supplements such as carrots and liver. We also have viral illnesses and health conditions. Now let's proceed to the steps in collecting the stool sample. First, instruct mother to wear latex gloves and wash her hands and her child's hands well afterward. It is to prevent contamination and growth of bacteria. Second, a hat-shaped plastic lid is used to collect the stool specimen. This catching device can be quickly placed over the toilet bowl or your child's rear end to collect the specimen. Using a catching device can prevent contamination of the stool by water and dirt. If urine contaminates the stool sample, it will be necessary to take another sample. Also, if you're unable to catch the stool sample before it touches the inside of the toilet, the sample will need to be repeated. Fishing a bowel movement out of the toilet does not provide a clean specimen for the laboratory to analyze. The stool should be collected into clean, dry plastic jars with screw cap lids. You can buy this at pharmacy, and you can also get this from your doctor or from the pharmacist. For best results, the stool should then be brought to the laboratory immediately. For the materials, at the left side we have a hat-shaped plastic lid, while the right side we also have the dry plastic jars with screw cap lids.
So ma'am, for the health teaching, make sure that your toddler gets or drinks a lot of water so that it will prevent for him or her to get a dehydration, and also make sure to avoid foods that will make the stool or the poop of your toddler green. And also, if the poop or the stool doesn't go away for a few days, make sure to contact your pediatrician because it may indicate further complication or further diseases.
For the additional health teachings, keep track on what your child is eating. So since dietary changes are the most common cause of green stool, keep a food diary and compare meals to stool output. Second, seek medical help if dehydration occurs. Dehydration is common when there's diarrhea. As a mother, you should be aware of the signs of dehydration, such as dry tongue and lips, deep breathing, dry and wrinkled skin, no wet diapers or urination for 8 hours for toddlers.